Hi, it's Paul here, Chief Executive. I'm just going to give you an update of what we talked about at the January board meeting. Again, as always, the board meeting was very busy and we started off with a patient story, as we always do. This month, our patient story was actually given by Donna, who is the advocate for patients who are suffering from domestic violence, and she works predominantly with staff in our A&E department, supporting patients and their families who come through the department who've perhaps through the course of their lives suffered from domestic violence, which can often be the reason why they've actually come to hospital in the first place. She gave some really powerful stories about how she'd worked with people who'd come into the department and been picked up by the team in A&E, and how she'd supported them to make disclosures to the relevant authorities and enable them to carry on and deal with the situation they found themselves in. I think for all the board it was quite an eye-opener really to hear just how prevalent domestic violence is within the local community, but also really positive to see what we're doing internally within the hospital to try and support patients and their families who are victims and how we can support them to get access to the right help. So that was a really, really good start to the board meeting, hearing about that. Through the board we also heard about our work with the wider Somerset system through the System Transformation Plan, Sustainability Transformation Plan, and particularly the focus we've got at the moment around turnaround within the health economy in Somerset. We have some significant financial challenges as a health system in the county, and we are working very closely with the Clinical Commissioning Group, Somerset Partnership Trust, Taunton Somerset and the County Council to see what we can do quickly to try and mitigate the financial pressures everybody's under and take steps to try and alleviate the pressure of the finances, not just this year, which is a real priority for everybody, but also over the next 5 years as we begin to make changes to the way health and care is delivered in the county as part of the Sustainability and Transformation Plan. We also talked a lot at the board about our performance, and I'm really pleased that we've got some really good stories to tell around our performance as a trust. Our A&E performance is really great at the moment. Last week we were #1 in the country for our A&E performance, and the board were really pleased to hear just how good and sustained our performance has been against the 4-hour standard, particularly when you think that this time of the year is normally the time of year in winter where we're dealing with significant pressures. Now we are dealing with a lot of demand coming through the A&E department and across the hospital, but I think the strong performance is a reflection on all of the teams who've been working so hard to improve the way we manage patients, care for patients safely, manage flow through the hospital. So the board really wanted to thank everybody for all of their hard work and efforts in that regard. We also talked about our waiting time performance, our referral to treatment times, and again we are very, very close to achieving the 92% standard for 18 weeks performance in this area, and we are one of a small number of trusts in the country that are going to be achieving that. So again, it's a real testament to the hard work of everybody across the organisation that we're doing so well on that, as we are also doing with our cancer performance and diagnostic waiting time performance. So overall the performance discussion at the board was a really positive discussion, and great to be able to share with the non-executive directors just how well everybody in the organisation is doing. We also talked about the finances, and as you'd expect, it's a hot topic given the significant financial pressure we are under, like everyone else in the NHS. But again, it's a really positive story in that we are on track to deliver our financial plan at the end of March, the end of the financial year, and also really importantly, we're on track to deliver our cost improvement programme this year. So the savings that we have to make as an organisation, we have to make £8 million savings this year, which is a huge amount on a turnover of £120 million. And again, I'm pleased to say that we're on track to deliver that. So it's a really positive story again to give on the financial performance, despite the overall amount of our deficit being a significant sum of money. Linked to the finances, obviously, our recruitment and retention of staff, and we talked a lot as well about what we're doing to recruit and retain nursing staff. The non-exec directors are rightly wanting to make sure that we have enough nurses in the wards and the departments across the hospital, and that we're doing everything we can to recruit people, and also making sure that we retain our good staff. So we talked a lot about what we can do to improve the way we care for staff in the organisation as well as caring for patients. And that led through to a presentation from Mark Appleby, our Associate Director of HR, about our staff survey results, where again we can see some good improvements in certain areas in feedback from staff, and we'll be sharing the findings of the staff survey with the organisation, but also departments over the coming weeks and months. So overall, a really positive update at the board, lots going on, lots to talk about, but overall a really positive picture despite the significant challenges we're all under. So thank you all for your help on that.